Last year, the Global Summit of Women launched a global consortium of women to end cervical cancer, which is a disease that afflicts women worldwide. Many of you may not know this, but 500,000 women are diagnosed with cervical cancer every year. And of that, more than 250,000 die worldwide. So it is a cancer that can strike women everywhere, and it strikes women during our most productive working years. So, you know, the question that was asked of me, why would a primarily business summit concern itself with this form of cancer? Well, the answer is very simple, because a woman's health is fundamental to her ability to engage in every arena of public life, including the economy. So if the summit is about helping women realize their economic potential, so keeping a woman healthy is very, very key to our mission and your mission. So the good news is that there is now a solution, and it's called prevention. There's now research that shows that this cancer is rooted in HPV, the human papilloma virus, much of which is discarded by our own internal immunities. But every so often, there are a couple of forms of HPV that result in cervical cancer. Well, the great thing is that there are now technologies that can diagnose and detect these cancers early on through screening and through vaccination, screening of women and vaccinations of young girls. And with these new technologies, we are able to, together, to help eradicate this cancer that only strikes women. This cancer, I have to tell you, doesn't discriminate. It is in every country, in every city, in every village. So how can you help? Well, first, inform yourself, and you yourself get tested. I had to ask my own doctor to give me an HPV test, and she was surprised that I asked for it, because she was just going to give me a regular pap smear. Secondly, inform your own family, those around you, and within your own business professional networks. That's the easiest way. Did you know about this? And lastly, those of you in this room are primarily leaders. You have access to information and communication media, like e-newsletters, for instance, or blogs, in which you can share this information. And you say, well, why do I need to do this? Because a lot of women and girls still don't know that they can be tested, can be vaccinated, and many of them still don't know about these technologies. So I invite you to join the Global Summit of Women in this effort. So together, I think we can leave a lasting legacy for our daughters, our nieces, our granddaughters, and the young women of our own communities. Cancer, frankly, is a 21st century reality, given the toxins we're exposed to, pollution, chemicals, and so on. So why don't we fight the one that strikes women specifically and leave a legacy of improving global women's health with this effort?